Welcome to Thoughtful Thursdays. Today we're going to be talking about travelling on the plane and during your holidays and all the precautions you need to take. And we're going to be explaining all the different things that we get asked as doctors regarding travel. What to do about the fear of flying, because a lot of people suffer from that and they're very frightened to get into a plane.
Very important topic to discuss, because many patients with their fear of flight can cancel their flight or delay or postpone because it is a real fear. It's a phobia. But you have to understand that those patients, they have mixed phobias. Yeah. It's not just the phobia of flying. Yeah. It's phobia of closed places.
Spaces,
it's the phobia of crowds. The phobia of heights. The phobia of any accident that happens while flying.
Absolutely.
So addressing all these phobias will help your patient. Initially, they will start getting better. But if you're looking for a cure, there is a long-term treatment plan.
And what do you suggest that they do when they're traveling and they have phobia?
If they're in a rush, I start telling them to face their fears. Okay, if they have time, they can take a flight course.
Yeah.
Okay. On the long run, they can do the CBT. This cognitive behavioral therapy.
Yep.
This might make them get away from the phobia.
Yeah.
And they fly without fear.
Yeah.
But this is a long-term process and needs many sessions. And you can add to the CBT a long-term treatment, some medications that help them.
Yeah, and I think that's important, especially if people need to travel more frequently, like maybe their family's in a different country or they've started a new job and they need to be traveling more frequently, and then they need to deal with the issue a bit more in depth. So yeah, that's absolutely very helpful advice.
Yeah, of course. Some jobs, like you need to travel every week or twice a month. So especially they have this job, it's a good job, they don't want to lose it, so and they want to find a solution. And on the short term, you can use other medications that you take one tablet just before you fly, and you will be relaxed during the flight without the phobia.
Yeah.
And these medications are short-term.
Yeah.
So once they land, the effect of the medication will go and they can run to their meetings. This is the nice thing.
And of course, things can get delayed on the way back, weather changes and things, and sometimes it's going to make them worry if they don't have enough. And what about patients that come to ask about how to deal with back pain and things while they're on the flight? Do you get much of that? Yeah,
actually, many people nowadays, they suffer from back pain. People who work at a different city, they have long drive every day. Yeah. They sit in the office long time working on their computers. And when they fly, they want to fly and have some fun. They don't want to suffer from back pain.
Yeah.
So the best treatment for back pain while flying is prevention.
Yeah.
You don't want to keep taking pain medication during your vacation.
Yeah.
And in this case, the best thing is back support. Don't leave a space behind your back, between your back and the seat, because the normal back curvature, there is a curve. This is a natural curve. Yeah. And if you sit for a long time, you will put the pressure on the vertebra and the muscles. So if you just use the neck support, everybody that uses the neck support, if their neck is okay, they can put this one behind their back.
Yeah, that's a good idea.
And this will take care of 50% of the patients with back pain.
Yeah.
And try to ease their back before traveling. Just don't put too much pressure on their back the few days before they travel, to take enough medications.
Yeah.
And to know that not to use the medication that causes drowsiness or sleepiness, because they want to enjoy their trip.
Yeah.
So I educate them. I give them the medication. I keep some medication standby if they have severe back pain, even if it makes them sleepy. They can take it at night, and they can manage.
Yeah, that's very sensible advice, and it's obviously a very common problem, with people, and especially with traveling in a flight. It's quite often uncomfortable seats, so usually it's also good to advise them to get up and walk around and stretch during the flight if they can.
If they look at the flight magazine, there are many advices how to stretch in their seat, like moving the ankles, moving the calf muscles.
Yeah.
And even I advise them for posturing, how to sit, how to try to move their spine. If there is time to walk around in the plane. This not only helps them with their back pain, but also it decreases the risk of the DVT, the deep vein thrombosis in the lower legs. Now, actually, the hospital is checking every single patient for DVT risk. And all those patients, if they are at risk, they are on anticoagulation.
Yes.
And some who are not, and there is an increased risk of getting this in the plane, we can give them some anticoagulation for their flight. And the stockings, of course. All these advices will sum up in one word: while you're in the plane, keep yourself hydrated. This is very important for your back pain, for your mental health, for your skin. And many people don't know that being in the plane, the circulated air is very dry, and it will take water from your body. So when you're sitting in a dry place, you lose more water with every single breath, and even from your skin. So they have to keep themselves hydrated. And for people who suffer from dry eyes, they take eye drops. They can take skin moisturizer, lip moisturizing, and especially people with skin problems, dry skin, or pregnant ladies.
Another issue people have often when they're flying, especially to faraway countries, is jet lag. Can you give us some advice about how to deal with jet lag?
Reaching to your destination. And one night comes, you want to sleep. And in this case, we can mention the jet lag. It's a big problem, but not for every flight. It's only or mostly for people who can cross 2 or 3 time zones, and it's most effective if they're going east. And what happens is that night comes, they want to sleep, they cannot sleep. They try to sleep, they cannot sleep. Daytime, they have to go out, friends, activities, lunch, and they feel sleepy. Everybody is active in the country they landed, but they feel sleepy, sometimes irritated, sometimes confused. So this can be solved by taking short naps in the plane, and using melatonin. It's over-the-counter medication. They can get it even from the airport pharmacy. And with time, they can get better and go back to their normal sleep pattern.
That's a good idea also, because it's also a problem when you come back to the country that you feel jet-lagged and tired and irritated. And the quicker you can get back into a normal rhythm, the quicker it goes back to normal.
Of course, and you have your job, and you have to deal with family, with work, and you cannot sleep at night.
Thanks very much for all your advice about these travel tips. It was really great talking to you, and hopefully we'll meet you at another podcast episode.
Thank you.